should be streaming here pretty soon. Goo, goo, goo. Sounds like my local computer. All right. Looking good? I think so, yeah. Hello, testing. Test. Whew.
It's time for Weird Medicine with Dr. Steve.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest-running show on this channel. I'm Dr. Steve with my little pal Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
This is a show for people who would never listen to a medical show on the radio. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call. 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy I can't mention contractually. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. Well, Dr. Scott, how's things going at simplyherbals.net?
Pretty well. We've been busy.
Yeah.
'Tis the season, as you can tell from my voice.
Yeah. You've got the Bartlett pear disease or whatever.
I've got the Bradford pear
pear,
tree blues.
Not Bartlett pear. What is a Bradford pear?
I think the Bartletts are the good ones and the Bradfords are the bad ones.
Does it make actual pears?
Yeah, they do make pears.
Really?
Yeah, but they're not edible.
Oh, really?
Yeah, and they have.
Why do people have them?
Well, because
They're like dogwoods. They're
they're
pretty.
No, they're not even that pretty. They're more like it's more like weeds. I mean, they just drop and they grow like crazy.
No, here's the thing. It says why. This is from Reddit. Why Bradford pear is so hated.
Yes. Oh, I can tell you why.
It's derived from a wild calorie pear native to Eurasia, but it has several traits that make it more desirable. But okay, go ahead. What?
Well, it's very easy to break. It's not a real stable tree, and the
Okay.
limbs break off really easy, and they fall in wind. They don't have a great deep root system.
Yeah.
And they have these beautiful white blooms every spring that I'm so allergic to. It just makes me absolutely miserable.
It says here the fruits, which are assumed to be inedible due to their abundant cyanide-laced seeds.
Well, there you go.
Jesus. They're hard, almost woody, till softened by frost, after which they are readily taken by birds, which disperse the seeds in their droppings.
And they grow like crazy. But the ones around here, they have thorns. I mean, I'm talking like 2 and 3 inch thorns on the branches, and they're just awful trees.
Yeah, they're remarkably resistant to disease, so that makes it even worse in some ways. Well, now it looks nice if you've got a whole bunch of them down a pathway or something.
Yeah, well, and I think that's why a lot of times they do it, especially like in our hospital system, and
yes,
we've got them
popular with landscapers because they're cheap.
Exactly,
they transport well and grow quickly.
Yeah, I've got them all over around. Well, you and I both have them around our whole building. You look out the window; they're everywhere.
Yeah, and then it became an invasive species.
Right,
That's typical because they're native to Vietnam, so they brought them here. Don't do that. I remember reading a science fiction story once when I was a kid about a planet where they had like these pests, so they imported these other pests, and of course those took over and made it worse. So then they had to bring in even worse predators, and by the end of it, they had these. The whole place was just a mess,
man.
and it's kind of like kudzu.
Yeah, right.
Kudzu was brought here, I guess, as ground cover, and then there are whole swaths of land in the south that the trees are just covered with kudzu. It's just killing them. If people don't know what it is, it's a vine that just grows like crazy. But apparently the root is edible. Do you know anything about that?
Yes, we actually use it in Chinese medicine.
Oh, is that right?
We sure do, yeah. I was just trying to think of the Chinese name for it. Guh.
Not kudzu?
No, it's not kudzu. But it is, we use the dried root. Oh, yeah, it's Pueraria.
Oh, yeah, I'm looking at Pueraria, but that's not a Chinese name, though.
No, I think that's the normal scientific name.
Okay.
But, they've used it
may
for years
treat
and years.
liver damage.
Yep.
Rich in antioxidants.
There you go.
It's not necessarily good. The body needs oxidants to fight cancer and stuff, so you got to be careful. There was this big push for antioxidants back in the 70s and 80s, and people who smoked were taking antioxidants actually increased the rates of cancer because they were taking away part of the body's defense against cancer cells, which is to be able to kill them with oxidants. At least that's the hypothesis, anyway.
Yeah, but so the vine or the roots are good in Chinese medicine, but man, the plant itself is just around here it'll cover whole hillsides.
Yep.
Trees, telephone poles.
It's called
everything.
the vine that ate the South.
Yep. That's exactly
Creeping, climbing, perennial vine terrorizes native plants all over southeastern United States. It's making its way into the Midwest, Northeast, and even Oregon.
Oh, geez.
Yeah. Native to Japan and Southeast China, first introduced to the United States during Philadelphia Centennial Exposition in 1876, where it was touted as a great ornamental plant for its sweet-smelling blooms and sturdy vines.
There you go.
Ugh. And then from the 1930s to the 50s, Soil Conservation Service promoted it as a great tool for soil erosion. I bet it is for soil erosion control. It was planted in abundance throughout the South. Little did we know kudzu is quite a killer, overtaking and growing over anything in its path. If you've never seen it, it's, there's trees, but they're completely covered.
Completely covered, yeah.
By this stuff.
It's like you just dropped a carpet over it, or a blanket.
Yes, a blanket of
like a blanket of green.
Yeah, it grows at a rate of 1 foot per day with mature vines as long as 100 feet. And then you just Google image it. It's crazy. I mean, there are just places where it just looks like green sort of monsters growing out of the hill, but they're actually trees covered by kudzu. But I understand that you can make bread out of it and stuff.
Oh, really?
Yeah.
We're kids. Our grandfather used to take us out, and we'd burn the whole hillside off of kudzu.
But then the root probably doesn't kill the root.
No, it'll come back next year.
Yeah, anyway. Well, what the hell? What are you going to do? All right. Well, you got anything, Dr. Scott?
Nothing good, but a bunch of sneezes I'm stored up for the show.
Yeah, because of the Bradford pears.
Yep. Yeah, gosh.
Now, we did have a call about the measles outbreak, and I thought since that's been in the news that we could talk about that a little bit. There's people are giving RFK hell because they think he's anti-vax, and he'll tell you he is not. I'm not here to defend RFK because I don't know his position. Maybe we could get him on the show. Maybe it'd be fun. But his thing is that the blind allegiance to just whatever we're being told isn't always correct.
Right.
And that there are, none of these things are perfect. So, for example, he's touting the fact that the measles vaccine will wane in effectiveness over time. But the truth is, and he's right, but the truth is it's about 5% of people could be susceptible to measles if they've been vaccinated. 95% of people have been fully vaccinated as children have lifelong immunity to it.
Gotcha.
And, we've had, in 2025, we've had 301 measles cases with a significant portion occurring in children under 19 of 76%. Most of the cases, this is 95%, were among unvaccinated or those with unknown vaccination status. 17% of the cases resulted in hospitalization. And so one of the things that people say is, well, on the Brady Bunch, they had measles and they had measles party, and that's how they talk about it. Now everybody talks about it like it's, it's a crisis. And neither one of them is exactly right.
Right.
Okay, so the measles, chickenpox parties, totally, I understand that.
Sure.
The measles parties, they did have those, but still 1 in 1,000 kids and up to, 3 to 5 in 1,000 kids, depending on where they are in the world, will die from this.
Huh.
And I was in kindergarten in 1960. The vaccine came out in 1963. And, of course, we'd all had measles at that point. But one of my friends in kindergarten died from the measles.
Geez.
So, yeah, it sucks. It's highly contagious. It can cause severe complications, but most of the time it doesn't. Young children and unvaccinated individuals are mostly at risk. The vaccine is a classic vaccine that's been around forever,
right,
since 1963. This one is pretty safe and effective. And but around the world in 2023, there are 107,000 deaths from measles, and but not in the United States. These were in places where people had decreased health care and did not have were compromised already.
Okay.
The symptoms are a high fever, cough, runny nose, and a rash. And prevention. Now here's one where the media was giving RFK shit for recommending vitamin A.
Oh, wow.
Actually, it's correct. Vitamin A plus vaccination helps to reduce complications from measles more than either by themselves.
Okay.
And that's been demonstrated. So, they got to – everybody just wants to get a W for their team and assign an L to the other team.
Right.
Stop it.
Right.
The only team that we have on this world is us, human beings. So let's look at the data and try to figure out what the fuck we should do about this stuff. So it is very contagious. Remember, we talked about R sub naught during COVID, which was the the transmission number. So if you had a R sub naught of 2.4, which the original COVID alpha was, then one person in an idealized population would infect 2.4 people. Omicron was 12, so one person would infect 12 people, which made masking ineffective. In the beginning, when this wasn't as contagious, maybe masking decreased. We had a period, there was a window in there where wearing masks might have actually made some difference in some cases.
Okay.
When there were 20 cases in Washington State and I'm in Tennessee, there was no point in me wearing a mask.
Right.
It was silly. If there was, okay, hang on.
Oh.
God bless it. Hang on. Okay. We're recording on the wrong track. Oh, God. Ah, God damn you. Not you, Scott. Okay, I don't know what's going on here. Nope. When there's 20 cases in, say, Washington State and there's no cases in Tennessee, it makes no sense. What's the purpose of me, wearing a mask? And then when it hits here and the reproductive number is low, then any barrier to droplet transmission will reduce transmission. However, when the virus mutates, and now all of a sudden the reproductive number is 12, which is the same as measles,
Okay.
then there is no protection.
Okay.
Because one person is infecting 12 people, it's everywhere.
Gotcha.
So that window is and that's part of the problem. There, when masking was recommended at one point, it almost, it made some sense, and then it stopped making sense, but then they wouldn't give up on it. And then you have people like that Taylor Loren saying that people who don't wear masks, even today in 2025, are raw dogging the air. That's what she said.
Oh, my.
And when you see her out and about, she's still wearing this cloth mask, which was already demonstrated that those things do nothing.
Yeah.
So anyway, the point I'm making is not about masking so much, but that measles and Omicron are about the same as far as their communicability. About 1 in 15. I mean, one person can infect about 15 people. So that's why you want, if you have a pocket of people who are unvaccinated with measles, they're probably all going to get it if they're living close to each other.
Gotcha.
So anyway, 2 doses of the measles, mumps, and rubella vaccine is 97% effective at preventing measles, and 1 dose is 93%. So it's not 100%. Nothing's 100%. Breakthrough infections are uncommon. They can occur, and it's mostly during outbreaks, and it's usually the number of breakthrough infections, in other words, infections in people who have been vaccinated, is about 5% if they're in the middle of an outbreak. Okay?
Gotcha.
All right. So anyway, So we had 301 measles cases in the United States so far in 2025. And 17% of the cases, as I said, resulted in hospitalization. And with the highest hospitalization rate among children under 5, they do have a hair trigger of putting kids in the hospital. I remember when my kids had rotavirus, they put them in the hospital, and they probably didn't need to be in the hospital,
Right.
So, but they're kids, and they can go bad
Keep
quickly, and they can get better quickly, so you put them in the hospital. One confirmed measles death in Texas and one under investigation in New Mexico. Now, they said they reclassified 3 cases that were supposedly vaccinated, and so they were classified them as breakthrough cases. But 3 of those were reclassified. 2 were vaccinated too close to the symptom onset to be effective, so they had just been vaccinated. Then they got the measles because their parents went and got them vaccinated after they got exposed. And it was too late.
Gosh,
it was too late.
Too late.
And then one was a vaccine reaction, wasn't measles. So anyway, so there you go. That's what's going on right now. Yeah. I am neither 100% pro all vaccines for everything. It took me a long time to get with the program on the varicella vaccine, because my concern is that if you didn't get lifelong immunity from it, you were going to now have adults who were susceptible to chickenpox who wouldn't have been if they'd just gotten chickenpox.
Gotcha.
But then I was convinced down the road that that vaccine does provide lifelong immunity. We'll see. It's not old enough for us to really see yet.
Right.
But if we start seeing a bunch of people getting chickenpox as adults, then we're going to know we're going to need boosters if they've had the vaccine, because they're never going to get the disease at that point.
Well, that would kind of eliminate
You're committed.
shingles. That hopefully eliminate shingles.
Yeah.
Which would be really great.
Yeah, it would be awesome. If we'll see. It's going to be another
that'd be great.
20, 30 years before we know.
Yeah.
But those people, once you vaccinate them as kids, you're handcuffed. If they don't get lifelong immunity, they will not get chickenpox, though, until they're adults, which is bad. Chickenpox in adults is bad, so you've got to keep vaccinating them if it's not lifelong immunity. So we'll see. We're going to find out soon enough.
Could they do blood tests or antibody tests or
antigen
tests? Okay.
Yeah, you're going to antibody test the whole country, though, because now all the kids have been vaccinated for
right,
this.
No, that's true. That's true.
But anyway, so so I'm like I said, I'm the mRNA vaccines. As far as the FDA still hasn't approved them.
Okay,
they're still under emergency use, so you can't mandate them. Right. I think that if you feel that you're at high risk for complications, then go for it. Okay. It does provide some protection. I know that at the end of Delta, when things were starting to calm down, everybody we had in the ICU was unvaccinated. Right. That's just, it doesn't, that's not good science or anything, but was interesting. But so I never was a fan of mandates on that. I think that if you have a mild respiratory infection, that treatment is the way to go, and we now have some pretty effective treatments for it. So it took a friggin' long time. But now the classic vaccines, no one's seen diphtheria in this country. You don't want to see it. No one's seen tetanus in this country in years. I mean, we've seen a couple of cases. I've seen one case of tetanus in my career. We don't see rabies much anymore. It's extremely unusual for people to die of rabies, although not zero. Could you look at the number of human rabies deaths in the United States?
I can, but real quick, I was just looking up TB because I saw the other day were TBs coming back.
Yeah.
Yeah, and that's not good.
Well, tuberculosis is one of those things that, we don't have a lot of protection against once we're exposed to it. Right. So now I did give somebody who supposedly had active TB mouth to mouth back in the 80s when they died and they were in the hospital with active TB. And at that time we were still doing mouth to mouth. but I never converted. So,
Interesting. Oh,
yeah.
would you on the skin test? You think you would show as having a
No, I never have shown positive. That's what I'm saying.
I know it well.
Yeah. So none of those things are 100%.
Yeah.
Somehow either the diagnosis was incorrect, which is possible, although they grew tuberculosis out, or I've just had a natural immunity, or I just got lucky as hell.
Yeah, I think I don't know if I told you this. My grandfather was one that always tested positive but never had it.
Yeah.
He was
right.
just, I guess, a carrier of some sort.
Well, he got exposed to it. He was
when he was a
infected. His
kid.
body fought it off, and that was it.
Isn't that wild?
Yeah, that's crazy.
Maybe he's just a tough old cooter,
Yeah.
Tough
Now,
man.
in some countries, they get the BCG vaccine, Bacille-Calmette-Guerin vaccine, and I know a lot of my friends who grew up in India had that, and it's used in countries with high rates of TB, and it's not routinely used in the United States because we have a low risk of TB infection in the country, but if that starts to kick in, we may start seeing BCG.
Huh.
They also use BCG for bladder tumors and stuff like that. It's crazy. Yeah. Interesting. They're working to develop new and improved TB vaccines. But, rabies, classic vaccine, measles, classic vaccine, all the classic vaccines like that. We just don't see these diseases anymore because of vaccination. So you'll never hear me criticizing the idea of vaccination because I will criticize specific vaccines and specific policies when it comes to vaccine, mandates and stuff. But, if you've ever seen rabies, which I've never seen a case of it, but I've read about them.
Sure.
And when I was a kid, rabies was, we didn't have rabies vaccine for dogs, and so stray dogs were monsters.
Oh, jeez.
I had a friend who came over. She was from India, and they didn't have, and where she lived, they didn't have rabies vaccine. She was terrified of any dog because they were just taught that they were monsters because you get one bite and that's it, So I'm watching that show 1923. You watched that? Taylor Sheridan.
Yeah.
Did you see the woman got bit by a rabid wolf, and they were giving her intraperitoneal rabies vaccine, which was a real thing until not too long ago. Intraperitoneal meaning that they had to put the needle through your abdominal wall.
Yeah.
Why? I don't know why they had to do that. Apparently, it grew. I don't know why. We need to look that up.
Yeah, and they had to do it every single day, didn't they? For like
12
days or something
like that.
Yeah.
Peritoneal rabies vaccine. Let's see what it says. Oh, shoot. Can you look it up?
Yeah, I'm looking up real quick. Yeah.
All right. Very good. Let's do some questions.
Number one thing, don't take advice from some asshole on the radio.
Very good. Thank you, sir. All right. Uh-oh. No, okay.
Hi, Dr. Steve. I've got a question about pneumonia.
Okay.
First of all,
Fatty
why does
pneumonia.
pneumonia start with a silent P?
Right. Well, I can tell you that. The P in pneumonia is silent because the word is derived from the Greek pneumon, and I don't know if in Greek they pronounced the P or if it was just a symbol, but it's Pneumon, meaning lung, and ya, the suffix ia means disease, so disease of the lung.
Gotcha.
And the thing is that when borrowed into English, the word was modified to fit our pronunciation words, which don't allow for certain consonant clusters at the beginning of words. So words beginning with PN or PS have silent P in English, such as psychology or psalm and pneumonia. And, other words with silent P's include like pterodactyl, and raspberry is a good one too. So it's just a silent P, and it's because the Greek had it, and we don't pronounce P's like that. That's it. Let's see if he had something else.
And then the other question is, it's sometimes classified as walking pneumonia.
Yeah.
What does that mean?
Okay, walking pneumonia is that is a specific type of respiratory infection caused by a an organism called mycoplasma, and mycoplasma is weird. It's not exactly a bacteria. It's not a virus. It's kind of it's a quasi bacteria,
Gotcha.
and it is one single celled. So, but it's different, and you kill it with different antibiotics. You tend to use, erythromycin or azithromycin to kill it. And you just get a cough and you have pneumonia and you're just walking around with it. That's basically where that came from. It causes generally a very mild syndrome. Mm-hmm. And so you could have pneumonia from mycoplasma and still go to work and not even know that you had it. So that's where the term came from.
You know, a lot of mycoplasma around in hospitals and respiratory when they do a lot of respiratory rehab stuff.
You're thinking of Legionnaire's disease, Legionella.
No, I thought I'd heard mycoplasma, but it might be. Yeah.
Legionella is found in water and stuff, and so when the first Legionnaire's disease outbreak happened, if I remember correctly, it was an air conditioner that had water pooled in it, and the Legionnaire's was blown into the atmosphere, and people were picking it up. But it's like the third most common pneumonia.
I remember that. Yes. I think it was.
And so we have to treat for it. If somebody comes in and we don't treat for Legionnaires, if they have community-acquired pneumonia, we don't cover it, then it's really is kind of considered malpractice.
Oh, wow. Okay.
That's how common it is. Way more common than people think it is.
Yeah.
But anyway, you were looking something up.
Yeah, I did. The information I found was that the WHO says it's technically an IM, so it's an intramuscular or intradermal. It wasn't.
What is? Wait, what is?
The rabies vaccine.
Oh, okay. Yeah.
It wasn't supposed to be intraperitoneal. It was supposed to be intramuscular.
It wasn't supposed to be. Why did they do it then?
I don't know. It's. I'm just reading different things. It's hard. Hell, it's hard to see. But
no, it isn't.
It is. I'm telling you. The WHO that says intradermal is easier now. Yeah.
Well, yeah, it's easier, but I mean, why did they have to do the one intraperitoneal? Let's see here. Let me see. Okay, intraperitoneal Okay, induced rabies-specific antibodies. Well, I don't know. I can't. Yeah. Okay, now I can't find it. But that was the old school thing, is that they would, because I remember when I was a kid, it was like when they finally came out with the rabies vaccine for adults, that I remember they were saying, listen, don't get around dogs, because just because we have a rabies vaccine, they're going to stick these needles in your abdomen.
Yuck.
But, okay, it says here.
I'll keep looking.
Okay, now here we go. It says the rabies vaccine's not been given in the abdomen since the 1980s. And let's see. It used to be that you had to get the shots in the abdominal muscle, so it wasn't really intraperitoneal.
Yeah, it says IM.
Yeah.
I guess it was to get through the fat part into the muscle part. Yeah,
I guess.
So it may have seemed intraperitoneal, but it was just intramuscular.
Yeah. In the old days, the schedule was 25 injections of rabies vaccine, 3 on the first day, 2 on the second, 2 on the third, 1 each day after 18 days. And this is one of those things that you're vaccinating people after they were exposed, so it has to work fast.
Right.
Because they've been bitten by something, and now you're giving them a vaccine. It's not like we give people, as we've demonstrated, the measles vaccine takes 14 days to kick in.
Right.
If your kid is exposed to measles, you can't then go, let's go get them vaccinated right now, because they're probably going to get measles anyway. So, but yeah, pretty interesting. All right,
good stuff.
Let's see here. Come on, yeah.
Hello, Dr. Steve.
Here we go.
Hey, man.
Hello, Scott.
What's up?
Hey.
Oh, God.
And the Fluid family.
She's not
and
here.
A question popped in my head I've never really known the answer to before. What is a seizure?
Okay.
Is it electrical?
Yeah.
Short circuit?
Yep.
Is it chemical based?
Well,
Can I use?
yes, yes to both.
Yeah.
We have electrochemistry in our bodies. That's how it works. So you have calcium and sodium channels and all these things that move ions around, and then that takes electrical charges and moves them around. So yes, it's electricity and it's
I have
chemical.
a friend who was a kid who was prone to grand mal seizures.
Correct.
They were just brutally violent to see.
Yep. Yeah, so there are lots of different kinds of seizures. It's basically a temporary episode of abnormal electrical activity in the brain, and it's just runaway electrical impulses, causes involuntary movements, can cause changes in sensation, changes in behavior sometime or awareness. So they're the least recognizable seizures are things called absent seizures, where people just go blank.
Okay.
And I remember in medical school seeing a video EEG of a person who had absent seizures. And so people thought that this person was faking or something, because they would just sort of blank out. And then you could talk to them, and then their eyes would flutter and stuff, and people thought they were faking. So what they did was they put a video camera on them and recorded them, and then had an EEG machine and put a camera on that.
Oh, wow.
And when this person's eyes would blink, the EEG machine would go crazy. So they obviously were not faking. They were actual seizures.
Wow.
And when they gave this person seizure medication to suppress those bursts, then they stopped doing the behavior. So, brain injury, stroke, brain tumors, infections, lack of sleep, certain medications can induce seizures. Low blood sugar, that's how they used to do shock therapy before they had the electrodes. They would give people doses of insulin and get them to have such a low blood sugar that they would have a seizure.
Oh, jeez.
So the absent seizures, then you have the sort of partial Jacksonian seizures, which is where it might start in the finger and then work their way up the arm, and then, other parts of the body, but the patient doesn't lose consciousness. And then if you have a generalized seizure, that affects the entire brain, and those people will lose consciousness. And then the tonic-clonic seizures, the ones he was talking about, is where they jerk and bite their tongue and that kind of stuff. That's basically what it is. And it's there'll be a focus of electrical activity that somehow propagates to the rest of the brain. And when you have those focal seizures, they might only affect one area of the brain. So some people will smell weird things.
Gotcha.
There was a guy once that when he had seizures in the temporal lobe of his brain, he saw himself, and it was as real as it could be, in ancient Rome.
Oh,
Yeah.
wow.
And so his thing was that this is the breaking through. And as a matter of fact, Philip K. Dick wrote a story about this, science fiction story. But, the sort of the past breaking through into the present. But it was a temporal lobe seizure. So it can be, you can alter your awareness. That's something, isn't it?
That is insane.
So if you have a seizure and you're an adult, they're going to restrict your ability to drive until they know that you're not going to have a seizure. And sometimes they make you not drive for a specific period of time, and it varies from state to state and what the rules are and stuff. So check with your primary care provider. All right.
Great question,
All
Stace.
right, that was a good one. Okay, now this one. Okay, let's see what this is.
Hi, Dr. Steve. I'm going to try to get through this without saying a million times.
Don't worry about it. That's all I do. So
It's me when I re-listen to these.
Don't worry about it.
My mother is an alternative medicine wacko.
Okay.
She had breast cancer 8 years ago and a full mastectomy, refused standard of care such as chemo, radiation, and estrogen blockers. 8 years later, that cancer has recurred. Yeah. She had another lumpectomy a few weeks ago. Pathology showed that it was 2 different types of cancer, one being very aggressive and liking to go to lymph nodes quickly. Has not reached the lymph nodes that they tested, but it was showing it was encroaching on the lymphatic system already. I forget the terminology for that stuff. Yeah, she again has refused standard of care, adamantly does not want radiation, and is going to her naturopath, who is treating her with mistletoe, which I stupidly thought was some brand name for some fancy protocol. Turns out it's just mistletoe extract.
It's truly
like
mistletoe.
Christmas time, kiss me under the mistletoe extract. I looked at PubMed, and there was some data on it, but always when used in conjunction with other forms of treatment like radiation and chemo, and nothing on its own. If she wasn't 80, I would tell her she's being a complete asshole.
Yeah.
But
well, let me tell you something about 80-year-old women and breast cancer. A lot of times it doesn't kill them because there is an inflammatory aspect to breast cancer for sure, because young women with breast cancer tend to do much worse than old ladies with breast cancer. I have seen 80 and 90-year-old women that had a breast tumor for 10 years and they didn't tell anybody, and now it's until it started fungating and smelling, and that still didn't kill them. My grandmother had breast cancer when she was 88. They did a mastectomy on her, and she lived to be like 100 or something. So listen, she made it to 80. It's a free country. You can make these choices, but you have to understand that there may be consequences to them. But chemo and radiation isn't a fun thing either. It's just that the data shows that there's an a percentage improval in survival, but you're sacrificing quality of life in the short term. So there's some people that just say, I'm not doing anything. And that's your choice. You have, as a human being, you have autonomy. But don't make those choices without being fully informed. You need to know the risks, benefits, and alternatives to the treatment that they're proposing, and you need to know what the odds are that something untoward is going to happen if you don't proceed with that. Now, let me talk about mistletoe, and then I know you want to say something.
No, I was going to add,
preparations of European mistletoe is one of the most prescribed drugs in cancer patients in several European countries. They say that it stimulates the immune system and improves survival. And now there was a review that they did of these patients, found there wasn't enough evidence to reach any clear conclusions about the effects on any of the outcomes, and therefore it's not clear what extent the application of mistletoe extract translates into improved symptom control or prolonged survival. But there's no good quality independent trials. And decisions about mistletoe extracts are likely to be beneficial for a particular problem. Got to rely on expert judgment and practical considerations, but we just don't have good enough data on this. But, I just don't understand. This is what I don't understand. Okay, I'm not going to do chemo. I'm not going to do radiation, but I'm going to do this other thing. It's like, why? Why choose that? Why just not do anything? Why do anything at all? Particularly when you're choosing something that has such shitty data,
Well,
I know people, it's human nature. You want to do something. Go ahead.
Well, and I was going to say, you and I actually have a friend that lives in Switzerland, a sibling of a friend that had stage 4 liver cancer. And metastases, decided to go through the chemotherapy and mistletoe therapy. So the mistletoe therapy over there is done by the
oncologist.
The oncologist, with really super high doses of the mistletoe. And it's pharmaceutical grade stuff.
Yeah, sure.
And I think that to me is a big difference than going out to a store and getting mistletoe oil or
absolutely.
Okay, you know what I'm saying? Yeah. So,
but still, if there's no data,
well, I think there's data there.
Okay.
Yeah, I don't think there's data here, but I think there's a lot of data there because that's one of their first line treatments. This gal has done exceptionally well and is considered in remission and does solely mistletoe. Now, again,
of course, an N of 1.
It's
N of
and I'm not saying that it cured anything, but what I'm saying is that if you're going to do anything, it's your choice. But certainly go with the best, most reliable resources you can acquire.
Yeah.
So there may be something to it. What I'm saying is,
how do we know? You do studies.
Yeah. Well, yeah, sure. But I think over there are studies in Germany and Switzerland, and I don't think they've been as what's a nice way to put this? As keen on researching that here for different reasons.
Well, okay, so I'm looking at PubMed, and let's just look at the data. So mistletoe for cancer, systematic review of randomized clinical trials. This is the internal International Journal of Cancer said mistletoe extracts are widely used in the treatment of cancer. Results of the clinical trials are, however, highly inconsistent. We therefore conducted a systematic review. So this is where you take clinical studies and then you mush all of the data together. Right. So 8 databases were searches to identify all studies that met our inclusion and exclusion criteria. They were independently validated and extracted by 2 authors, checked by the 3rd according to predefined criteria. Statistical pooling was not possible because of the heterogeneity of the primary studies. In other words, they were shit studies because if they were good studies, in other words, double-blind, placebo-controlled, studies crossover or not, you would be able to combine the data of those. Gotcha. So they did a narrative systematic review. 10 trials were included. Most of the studies had considerable weaknesses in terms of study design, reporting, or both. Some of the weaker studies implied benefit of mistletoe extracts, particularly in the terms of quality of life. None of the methodologically stronger trials exhibited efficacy in terms of quality of life, survival, or other outcome measures. So this is one of those things. It says rigorous trials of mistletoe extracts failed to demonstrate efficacy of this therapy. So this is, because they traditionally use it in other countries and it's purified and all this stuff. I can have purified stool extract and it's purified and everything, but it's still, I wouldn't want to give it to anybody. Yeah. So that's the thing. Now, is there a subset of people that this stuff is an absolute, panacea and a cure? There may be. Maybe, yep. But we got to determine who those people are. Yeah. But right now, the studies, at least when this was done, when this was old, were shite. Right. Yeah, and again, I'm not saying one way or the other, but I'm saying if you're in that situation, it might be hell. As well as I do. No, I know. A lot of those medications come from herbal medicines anyway. Well, we've talked about that all the time. But let's look at clinicaltrials.gov and see if I'm just putting in cancer, and then I'm going to put in mistletoe, and let's just see what we come up with. Okay, here we go. There are 20 studies. Okay. Mistletoe extract in early or advanced breast cancer, a feasibility study. That one's been completed. Randomized controlled trial with adjuvant mistletoe treatment in gastric cancer patients. That was completed as well. And let's just see if there are any results that we can look at. Okay, here are publications that came out of it. And here it is. Okay. Quality of life, immunomodulation, and safety of adjuvant mistletoe treatment in patients with gastric carcinoma, a randomized controlled pilot study, but still. Said, let's see, global health status. I don't know what that is. That's a parameter I'm not familiar with. It says diarrhea was less frequency reported in the intervention group. No significant treatment effect on levels of tumor necrosis factor, CD19, lymphocytes, and liver function tests. It says additional treatment with this is safe and associated with improved quality of life. Okay, so they're saying they're using this global health status. That was the only thing that they found. Well, okay, I'll take improved quality of life. Yeah, sure. Would like a little bit more data on that. That sounds like they really wanted to have a positive result, so they finally found something. Hey, at this point in our lives, we're shooting for not bad. Yeah, we're not shooting for good anymore. We're just shooting. Here we go. Mistletoe and treating patients with refractory advanced solid tumors. This one was completed. Let me see if a publication came out of that. Yep, it did. I love clinicaltrials.gov. Okay, here we go. Now this is a phase 1 trial. Now listen, this is and this is 2008 too, and they did this phase 1 trial. I don't see phase 2 that was ever done. That's not good. Yeah. So it says it possesses clinical activity, but that's all you get, So the data's not super great, but yeah. Well, let's go. I don't think it doesn't seem like it's doing any damage. I was going to say, let's just go with this. Let's say if it may not hurt you. Yeah. If it doesn't hurt you, it may be okay. Well, okay. If it doesn't hurt, it still may be a placebo, but at least it's not doing any harm. Yeah. Okay.
Hey man, guess who?
Oh,
Tagdale, man. Tagdale. It's been quite a few years since the old UNC group was together, and we just reach out and call you, man.
Okay, I don't know. Okay.
Hey, Dr. Steve.
Hey, man.
Got a question on peptides.
Yeah.
KP10.
Yeah.
Using that instead of doing
Testosterone.
any type of testosterone.
Yep.
Or statins.
Okay.
What's he doing?
Kisspeptin 10.
Kisspeptin.
It's called KP10. It binds to this protein called GPR54. It doesn't matter. But it results in the release of gonadotropin-releasing hormone, which then causes the anterior pituitary gland to secrete luteinizing hormone and follicle-stimulating hormone. Now, in males, what that will do is promote spermatogenesis, in other words, increase sperm count, and increase testosterone. So this is another way. We've talked about clomiphene on this channel before. This is another way to stimulate testosterone production without just supplementing testosterone and turning the testicles off.
Gotcha.
This actually causes the testicles to do their job. It's like, just do your job. Now, the kisspeptin 10 in the human body is critical for puberty onset and reproductive function, and it's being investigated as potential treatment for reproductive disorders. Where's that coming from?
I don't know.
Is that you or me?
Not me. Maybe front door.
What the hell?
I don't know. I thought I heard maybe front door.
Yeah, I think my synthesizer. Let me see. Yeah, there we go.
I was gonna say,
I
let
hit
me, I swear.
Yeah, it was my Moog subharmonicon. Sorry, everybody. So, yeah, this kisspeptin 10, you can buy it for research purposes. And it increases, like I said, it increases testosterone levels. And they're looking at it as a treatment for delayed puberty or, hypogonadism and stuff like that. And it has a lot of potential therapeutic applications for any condition that involves testosterone deficiency. So now, would I advocate that you go to one of these research sites and buy this stuff and inject it yourself? Hell no. There are some downsides to it as well. It's pretty well tolerated, but you can get hot flashes, headache, nausea, fatigue, reactions at the injection site, etc. So they don't know what the long-term effects are. They don't know what the interactions are with other neuroendocrine systems. So it is a very interesting subject of research that's ongoing. I'm not ready to recommend it yet. Okay?
Yep.
But that's what that's about.
Cool.
All right. Let's see here. Okay, this is...
Hi, Dr. Steve.
Hey.
It's Tom from Michigan.
Hey, Tom.
Since I last spoke with you, I have been diagnosed with health anxiety, or as it used to be called, hypochondria.
Correct. Yeah, we don't call it hypochondria anymore because that got on the euphemism treadmill. Remember we used to talk about the euphemism treadmill?
Yeah.
That the word moron used to be a medical term.
Yep.
And if for a person with a specific range of IQs, and then people started going, you moron.
Moron.
And so now you can't call people that anymore on a medical thing anymore. Now it's pejorative. And hypochondriac became the same thing. So now it's just health anxiety.
Health anxiety. Gotcha. Okay.
This all started when I lost my father and my mother-in-law 2 months apart, both due to cancer.
Yeah, I'm sorry.
Recently, I had some blood work, and I made the mistake of getting the blood work done 10 days after I started the flu.
Okay.
So I got better from the flu, and then a couple of days later, I go in for a physical. There were a couple maladies in my blood work.
Probably lymphocytosis.
3T4 was high. The doctor rechecked it, and it was fine.
Yeah.
The other one that was high that she didn't recheck was my platelet count. The high range should have been 400. Mine was 502.
Yeah.
My doctor said
that is
the high platelet count could be due to the recent infection and
Give thyself a bell.
Swelling or whatever you guys.
Yeah, it's called an acute phase reactant. He had a little bit of what we call thrombocytosis. Mm-hmm. We worry about thrombocytopenia. In other words, insanely low platelet counts. Mildly elevated. Mildly elevated platelet count is usually a sign of recent inflammation in the body. So
that goes with it. But since I'm a hypochondriac, I don't believe her.
Well, you're not anything. You suffer from health-related anxiety. We're not calling people diabetics anymore or alcoholics. That's kind of gone away now.
Yeah.
We say you have someone with, alcohol abuse disorder. They're not an alcoholic. It doesn't characterize them. You're not characterized by being a hypochondriac. You have health-related anxiety.
Gotcha.
You need cognitive behavioral therapy. That's the one that's going to help the most. Find a PhD psychologist who practices cognitive behavioral therapy, usually 6 to 10 visits, and you can have this under control. So you just need to talk to somebody about that. And this is one, no pill's going to fix it. You need talk therapy. Okay?
Yep.
I want to get to this question over here. It's called Drink or Die.
Hey, Dr. Steve. How you doing?
Good, man. How are you?
All right. This is Mike calling from Chicago.
Hey, Mike.
And I've got a question about a story that I was told that I found particularly horrifying. And it may be apocryphal, or it might be true. I don't know. But I want your opinion. The story comes to me from a friend who was big into fraternity life in college.
Yeah.
And they would throw these parties that they called Drink or Die. And in this party, everyone would be served a shot of methanol.
Yeah. Okay. I'm going to stop him there. I don't want anybody doing this. Methanol. So what they would do is they would do a shot of methanol, and then the treatment for methanol is alcohol and copious amounts of vodka, basically.
Oh, geez.
Because the liver will metabolize the ethanol before the methanol, and then you'll excrete the methanol. It doesn't take much to kill you. Drinking 25 to 90 mLs, that's 0.7 to 3 ounces of methanol, can be fatal without proper medical treatment. This is stupid. If you're in a fraternity that's hazing people with methanol, get the hell out of there. And you got to report them because someone's going to die.
Yeah, knock that shit off.
Yeah, don't do that. Okay? All right. Drink or die. No, just drink. Don't die.
Drink.
Please don't die.
Responsibly.
All right. Thanks, everybody. Check your stupid nuts for lumps. Quit smoking. Get off your asses. Get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. All right. Okie dokie. I have got to swap out this computer. I know I've said that for months.
You're as bad as they.
Well, it's a pain in the ass.
I know.
Do you see all the connections there?
I know.
And I have to have a new hub, and then the hubs don't work right, and it's a nightmare. But I have to do it because this is this computer cannot run OBS and Logic Pro at the same time.
Hey, I do have 2 questions.
Okay,
and a statement.
All right, Dr. Scott. So no methanol.
No methanol.
Okay. What are symptoms of methanol poisoning? Well, the problem is methanol's ingested into the body. It's converted to formaldehyde and then into formic acid.
Oh my!
And that makes your blood acidic, and then it's distinguishable. It's indistinguishable in the beginning from inebriation, from normal ethanol consumption, and then 12 to 24 hours later, they get abdominal pain, nausea, vomiting, breathing difficulty, blindness, blurred vision, seizures, or comas. And there are places where people will put methanol into actual ethanol and sell it just to stretch it out. It's like stepping on heroin, where you put it in
you cut it with something,
milk or whatever the powder is that they use. Powdered milk or whatever.
Baking soda.
I guess. Is it?
Whatever.
I don't know. It looks like
I really
but I don't know what the hell. But they will do that, and you'll get outbreaks of methanol poisoning in mass. There was, I think, a mass outbreak of methanol poisoning in Iran where like 600 people were affected by that. So, and India's had a few, and then there's some few in the United States and everywhere else too. So just stay away from methanol. Not good for you. If you treat it within 10 to 30 hours of ingestion, it can be treated. You get them to a hospital that has dialysis equipment, and then they use this drug called fomepizole, and it inhibits methanol metabolism, but it's not readily available everywhere. And if they don't have it, then they give them ding, 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 high doses of ethanol immediately. And as I said, the liver will process the ethanol first, and then the methanol poisoning is delayed and allows for more time to process methanol out of the person's system. They will give them sodium bicarbonate to neutralize the formic acid, but the patient may need to be put on dialysis.
Oh, goodness.
All right. Isn't that something? All right, what do you got from the fluid family, my friend?
So let's see. We had a statement from McRibs. Hey, did Dr. Steve catch Anthony Acumia's subtle shout out to his?
I heard about this
on his now syndicated AM radio show.
I heard that there was a Dr. Steve fluid.
He did a fluid,
but I missed it. If somebody can find that for me, I would love to find it. It was on his first show.
Yep.
I did watch some of it, but I didn't watch all of it. But Anthony got a gig at WABC doing 2 hours on Sundays.
Okay.
And then the next day, maybe 2 days later, he got an offer to syndicate to like 300 stations.
Oh, wow.
So, yeah, that was pretty interesting. So that's going to be fun.
That's cool.
And I'm looking forward to that. And really what it is, it's a test of cancel culture. That's what this is. And because Anthony was, quote-unquote, canceled, and now he's back, is he going to be able to maintain that? And he's had a YouTube channel, and he's had a network and all this stuff with paid subscribers. So it's going to be very interesting to see how this goes with him back on terrestrial radio.
Gotcha.
And, Dr. Dean Adele, I'm way past my prime, and I'm not a good enough broadcaster, but, Dr. Dean Adele made his living doing an hour a day, doing what we do here for nothing.
Yep.
So maybe Anthony will let me ride his coattails onto something.
Well, there you go.
I've always talked about doing a terrestrial show where we would still talk the way we do here, but we would just beep out all the F words and stuff. I think it'd be fun. You'd have to pre-record it. You wouldn't have to be able to do it live.
Right. Well, and as well as I do, sometimes bleeping out those
it's funnier.
words it's way funnier.
Yeah.
I mean, the greatest, most hilarious thing I've ever heard done on this show was when you had Liam do that bit. Oh, my, Mrs. Madison or
Ashley Madison. I had
that is the greatest thing because you can fill it in.
I just had him say poopy and stuff, and then I bleeped it out, so it sounded like he was saying something else. Yeah, that's funny.
You want a question?
Yeah, go ahead.
Are you looking that up?
I am.
Oh, yeah. Let me read you a question. This is from Barb.
Okay.
Hey, Dr. Steve, Dr. Scott. I've been taking meloxicam for a week. My doctor gave me a 2-week prescription for pain I was having in a knee and leg. This stuff is unbelievable. Is there an alternative to take when my 2-week runs out? So that's a lot deeper question than
Well, yeah.
Yeah, there's a lot to that.
You want to talk about meloxicam?
We'll talk about meloxicam. It's a COX-2 inhibitor.
Yep.
It's an anti-inflammatory.
Right.
Give thyself a bell.
Correct.
Just about
Explain
the same thing.
What that is.
Well, it's just like Celebrex and ibuprofen, where it blocks these pain sensors.
Yep.
And the problem with meloxicam, Celebrex, ibuprofen, they can be
meloxicam is sold as Mobic.
Mobic, yeah. And they have a topical form also, which actually is pretty good. The cream.
They do a meloxicam.
Yeah.
I know they do a Voltaren.
I think Voltaren is meloxicam cream. I think.
Oh, it is.
Yeah, I'm pretty sure. I'm not 100%. You can check.
Okay.
But yeah, Barb, that is a great medication taken occasionally. It can be kind of tough on your GI system. That's one of the main problems with it. Like a lot of the other medications in that class.
No, I knew that wasn't right. Voltaren is diclofenac.
It was diclofenac, not meloxicam?
Yeah, it was not meloxicam.
Okay. Meloxicam, great medication, but there are some alternatives because what she was wanting was some alternatives.
Yep.
We use curcumin, which is turmeric.
Yeah, when he says we, he means he.
The freaks. The freaks.
No, it's fine.
No.
Turmeric is a COX-2 inhibitor.
It is also a COX-2 inhibitor, and it has been shown.
And there is a topical meloxicam, too. So go ahead.
And it's not called Voltaren?
No, that's diclofenac.
Shit. I was 99% sure. Hey, but there's another thing, and Dr. Steve actually found this and sent it to me a few months ago that I actually personally used. It's called dihydromycin. It was a black, it's actually the berry of a black pepper plant.
Oh yeah. Right.
And there is a little bit of research on this. I use it for inflammation, and it is an oral thing that I take every single day, and it doesn't seem to have any ill effects on me. So there are some other things besides the meloxicam, and sometimes some of your doctors will put you on it for long periods of time if you'll monitor GI issues, like gastric ulcers, bleeds, and things like that, inflammation, gastritis.
Well, the COX-2s also can increase risk of cardiovascular events too.
Right,
so,
and blood thinner,
so the thing that you are concerned about is, the long-term effects of meloxicam. I've known people that take it every day. The one that you don't want to take every day is ketorolac, which is Toradol.
Yeah.
If that's a 5-day maximum on that one because of the risk of kidney function damage or kidney damage. But there's a new drug. There's a new drug on the market that is being covered pretty well by insurance called suzetrigine. It's also sold under the trade name Journavax. It's Journavx. And, as a brand name drug, if you go to their website, journavax.com, you can get a prescription card, and you never pay more than $30. And they're not a sponsor of the show or anything, but it's a brand new drug, just came out. It's not a non-steroidal, and it's not an opioid. It is a completely different thing that blocks pain fibers it blocks a certain sodium channel in peripheral nerve fibers, and those are nerve fibers out in the, away from the central nervous system. And that sodium channel, NAV 1.8 or whatever it is, will normally transmit pain signals to the brain, and when you inhibit that, it blocks that. So the painful stimulus still happens, but you don't experience the pain. And that might be something, because this stuff doesn't look like it causes ulcers. It doesn't look like it causes liver toxicity or anything like it. So this is part of the problem.
Of course, it's early.
You have, right. Well, they've gone through phase 3 and they're in phase 4 now, but you're right.
But it's still early.
It's early, but again, in phase 3, you're going to see ulcers and liver toxicity and stuff because they're testing for it. But if there is there, once you get into phase 4, which is aftermarket, it's going to be rare. It's not rare with ibuprofen and all these other things. So, so number one, it is shit. Now I forgot where I was going with it because fucking Dr. Scott.
Oh, for God's sake, that's my fault. Hey, well, other options besides meloxicam, they can mix in Aleve, which is a different kind of anti-inflammatory, which is not cardiotoxic.
Naproxen is Aleve. It probably is the safest of the bunch. Oh, I know where I was going with this. Sorry, let me get this out before I forget it again. So you got a little old lady, right?
Right.
And maybe they're on a statin, and maybe they drink a little bit or something like that. So if you give them too much aspirin, or not aspirin, if you give them too much Tylenol, it's going to affect their liver. And even if you get above 3,500 milligrams a day, it may affect their liver. So we try to avoid Tylenol. Well, if you give them a non-steroidal, like ibuprofen or something like that, then you run the risk of not only cardiovascular events, but bleeding ulcers and stuff like that. So in those cases, the safest thing for some of them is going to be an opioid, except that those things can cause disequilibrium, cause people to fall and break their, knees and hips and stuff. So, but it is safer than in some elderly particularly than a non-steroidal or Tylenol might be. This stuff may be an alternative for that. A lot of people a lot of doctors will throw tramadol at people.
Sure.
And tramadol is sold as Ultram, and they think it's a safer alternative. It's still considered an opioid because it still stimulates the mu opioid receptor. Right. And the other problem with tramadol is it is serotonergic, and meaning that it increases serotonin levels in the brain, and so do antidepressants. So now you run the risk of getting serotonin syndrome, which you don't want if you mix it with an antidepressant. So it's a dirty drug, but I see a lot of my colleagues just throwing it out there, thinking that it's somehow safer than these other drugs, when in fact it's dirtier, and it still isn't. Affects that mu-opioid receptor, so it causes, it can cause euphoria, withdrawal syndromes, all the stuff that goes along with an opioid. So suzetrigine or Journevax may be something really interesting going forward.
So there are a bunch of other options.
Yeah, lots of other options. Yeah. Exactly right.
All right, last question of the day.
Yep.
From Pun, the number one Pun.
Yep.
He's got some weird medical issues, been shot a couple times.
Oh, well.
In his stomach and
why?
Abdomen, thighs. But anyway, that's not his.
Were you in the military, or are you just like an asshole? And
we're probably better off not knowing. So here's
sorry, one pun.
Here's
he's
the
always
one
in here.
pun.
I need to be nice.
Just wondering about belly bulge. Was overweight. Life crashed. Became homeless. Ate like crap. Drank a lot.
Oh, okay. Well, I'm sorry.
Yeah, no, it's terrible.
No, he's had a rough time.
Yeah. So that, and of course, getting shot multiple times.
Yeah.
So real quick, as far as that goes, some things that you can do that don't cost a whole heck of a lot of money.
Yeah.
Is there's an old saying that we have. He who walks a mile after dinner lives a long life.
Yeah.
So and part
the physiatrist will say motion is lotion.
Yeah. And that will help a lot of those foods that convert early to sugars burn off quickly, so you don't store them as fat.
And you're storing them in a specific place in your abdomen. That's what it is. Is the belly bulge is caused by fat that's stored in that, the panniculus, but also the area of the body that supports the intestines. Yep. And that part of the body, for whatever reason, will take on fat more than others. And so you think that there's just intestines and gas and stuff in there, and that the fat is all in front of it, but it's not. It's actually behind it. So go ahead, Scott.
So I think that's one thing, and again, just finding foods that don't convert really quickly to sugar, which are simple, or in your bloodstream, which will spike your glucose and do tend to get stored. So looking for more proteins, and some proteins that are not super expensive would be like a peanut butter. Peanut butter that doesn't have a lot of salt in it.
Yeah.
Peanuts, almonds,
or sugar.
Yeah. Just don't get the ones that have sugar in them. So finding foods higher in proteins that are nutrient dense, and those will help some too. And then finding drinks that aren't sugar, kind of full drinks.
Yep.
Water, of course, is your best option.
Yep.
And avoiding things high in sugars, which are wines and liquors, and sadly beers and.
Well, beer's the worst.
It is the worst, I know.
No, liquor, is low in carbohydrate content. So, but it's usually people run into trouble with what they mix it with.
Yeah, sure.
But processed foods, sugary drinks, and then just believe it or not, reducing your stress and getting enough sleep will help you get rid of some of that belly fat, which seems crazy.
Yep.
But limiting alcohol intake, choosing the healthy fats, like Dr. Scott said, avocado, nuts, olive oil, that kind of stuff, controlling your portion size, staying hydrated, limiting alcohol intake, and then fiber-rich diet really helps. You don't process so much of the fiber. It keeps you full, but you're not digesting it and storing it as fat. Now, regular physical activity, as Scott said as well, they say 150 minutes of aerobic exercise a week, walking, jogging, or swimming. I need to do that. When my back went janky, then I kind of quit doing all exercise. Then I had 2 years of no pain, and I should have been exercising, but I was already in that lazy mode, and now my back is back again. I just had another epidural recently, and now I'm all jacked up on steroids. But yeah, so it isn't easy, but it is doable. Lots of people can get rid of that belly fat, but it is the last. It does seem like the last to go. But if I drank 2 beers yesterday at the casino when I was playing Ultimate Texas Hold'em.
Oh, my.
And I gained 4 pounds.
Oh, my.
It's fluid.
Yep.
But there's a lot of carbohydrates in there as well. So you got to get rid of beer. Beer belly is a real thing.
Yep.
But anyway, it is a process, and it may take you years to get there. But as long as you're putting one foot in front of the other and staying on the program, you can get rid of the belly
will get
fat.
there, yeah.
And I'm glad you're doing better.
Yep.
I shouldn't have, he's probably got shot when he was homeless, and now I feel like an asshole for making a joke about it. So.
All right. Well, listen, we'll try all those things and let us know.
Yep.
That's
Chris R. Thanks for being a member of the Fluid family, and we appreciate you guys. Anything else, Dr. Scott?
No, sir. I believe it'll do her.
All right. Well, thanks always go to Dr. Scott. Thanks to everyone who's made this show happen over the years. Listen to our SiriusXM show on the Faction Talk channel. SiriusXM channel 103. I don't know when. I think 7 p.m. on Sunday, but sometimes on Saturdays, too, when there's not sports. On demand, other times at Jim McClure's pleasure. And thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Thank you, guys.
All right, now let's go to the opening. All right, you ready?
Yep.
See, that's the things that are coming out of your mouth, child. Babbling, insanity, delusions.
Man, you are one pathetic loser.
You get nothing. You lose. Good day, sir.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider. Gives me street cred, the whack alternative medicine ass faces. Hello, Dr. Scott.
Hey, Dr. Steve.
This is a show for people who never listened to a medical show on the radio or the internet. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we're not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Very good. Check out stuff.drsteve.com. That's stuff.drsteve.com. Scroll down. You can see the Rode robotic guitar and bass tuner. I think you tuned up your mandolin with it once, too, didn't you? Did you try that? I believe it will.
I believe it does, yeah.
Yeah, it'll tune just about any stringed instrument. And or you can see it at roadie.drsteve.com. They also have the Rode Coach. It'll teach you to play your instrument, or if you have a friend or a kid that has a guitar just laying around, throw them a Rode Coach, see if they can learn how to play. Check out Dr. Scott's website at simplyherbals.net. And don't forget patreon.com/weirdmedicine. We got all kinds of eclectic stuff on there. Everybody sees everything there first. And all the Dave Landau stuff, the live streams when we quit doing the SiriusXM show will all be there. And there's, classic Weird Medicine shows from way back in the day that you can't hear anywhere else. They're literally not even on our website. So check that out, patreon.com/weirdmedicine. And then if you want me to say fluid to your mama or anything else you want me to say, cameo.com/Dr. hackamania.com/weirdmedicine. Cheap, $5, if that. Sometimes is low. When I go out to Hackamania, I'll probably drop it to $1 just to do it in Las Vegas. It'd be fun. I'd like to do as many as I can. Cameo.com/weirdmedicine. All right, sir. What are we playing today?
Let's try a little Tennessee Jed.
All right. And that is Ultimate Guitar. Got it.
Going to try a little Tennessee Jed.
Yeah, let's do it. Which one you want to do? 310?
Yep.
Okay. Now, did Garcia have some connection to Tennessee? Where was he from? He was from he California?
Yes, he was from just north of San Francisco.
Oh, okay.
Yeah, kind of grew up in the the wooded areas.
They just had an idealized view of what Tennessee was.
Well, you know what? He started out, his first love was bluegrass.
Oh, okay.
Yeah, so he loved Doc Watson and he loved.
Okay, well there you go.
That's why he plays a lot of those old.
I told you I worked with a guy that taught Doc Watson his first chords on his guitar.
Unbelievable. Let me get some. Let me get this little deal over here. You got a microphone?
Huh?
Microphone?
Yeah, you want it?
On the.
Yep. It's on.
Oh yeah, talk. Yeah, sorry. I realize it was on. Let's do. So the only weird part is the at the end of each verse, the transition into the chorus. It goes to a B flat and then an F.
Huh.
Yep.
Okay.
And that's the only. Yes, and I'll just run some. I'll do it, and you make it sound pretty.
I'll just try to.
You just make it sound pretty. I'll do just a little C run intro.
Okay.
2 of them, and we'll get to it.
Okay.
Cold iron shackles, ball and chain. Now listen to the whistle of the evening train. You know you're bound to wind up there if you don't head back to Tennessee jail.
Hang on.
I gotta get that fucking thing, I'll get it. I'll get that thing. I keep missing that stupid G. I can't get situated here.
Okay.
Yeah, I think,
right.
Yep.
Okay, start from
3. Yeah, 3, 2, 1. Yeah. Cold iron shackle, ball and chain. And listen to the whistle of the evening train. You know you bound to wind up dead. You don't head back to Tennessee jail. Rich man stepped on my poor head. When you get back, you better butter my bread. You know it's like I said, you better head back to Tennessee jet. B flat. Tennessee, Tennessee, there ain't no place I'd rather be. Baby, won't you carry me back to Tennessee? We'll drink all day and rock all night. Law come and get you if you don't walk right. Got a letter this morning, children, all in red. Better come back to Tennessee, Jen. Well, I drop both flights and drive my side.
I thought it'd be.
Honey, come quick with the iodine. Catch a few weeks, baby, under my bed, and then head back to Tennessee, jet. B flat. Tennessee, Tennessee, there ain't no place I'd rather be. Baby, won't you carry me back to Tennessee? Sorry. So I walked into Charlie Fog. He blacked my eye and he kicked my dog. The doggy, she looked to me and she said, let's head back to Tennessee, Jen. Well, I woke up feeling mean. I went down to play the slot machine. The wheels turned around and the letters read, I better head back to Tennessee, jet. B flat. Tennessee, Tennessee, there ain't no place I'd rather be. Baby, won't you carry me back to Tennessee? B flat. Tennessee, Tennessee, there ain't no place I'd rather be. Baby, won't you carry me back to Tennessee? B flat. There you go. That's tough.
That's a tough
It's
one.
hard. It's a lot harder than you think.
Yeah. Now, when you're going to do that solo,
I
you're
could
going to have to
do a better job.
Well, we got to actually do it either the way it's written, or you got to tell me how you want to do it, because I didn't know when to go to the B flat.
I was hoping to yell B flat real quick.
It's all right.
At the last
try
one.
it again.
Yeah, let's do it. Yeah, I you know, where I screwed up every single time, almost every single time, was that. So let's do that walk down.
So the C diminished.
Yeah, the C diminished. Yeah. So what I do is I'll do a so it goes from F. Listen to the whistle of the evening train. So here we go. So so I'm going to go. It's a C. So you know you bound to a D minor 7. Wind up dead in the C7.
Yeah.
And, yeah. So let's try that again. So and that's what I just killed every time. 1, 2, 3. You know you're bound to wind up dead. Don't head back to Tennessee, Jen. One more time. You know you're bound to wind up dead. Then head back to Tennessee, Jen. At least I'm consistent missing that G and making it an A sharp or whatever.
All right.
But I am consistent. Yeah, let's give it one more time.
All right.
That's such a fun song.
Yeah, if we can get it right.
A little bit dialed in.
All right.
All right, here you go. So, in the break, let's just do. We do that break. It'll be
the solo.
Yeah, the solo.
Let's do the verse.
Just do the verse. You know what we'll do? We'll do the verse, and then when it comes to the C diminished, we'll just do that. That's not good. Okay, that's what we'll do. We'll just do the verse, and after the C diminished, we'll go back to the.
Okay.
Gotcha.
I guess I'll try to follow.
You'll get it.
Okay. Ready?
Yeah, let's do it. Ready?
Yep.
1, 2. 1, 2, 3, 4. The cold out shackles, ball and chain. And listen to the whistle of the evening train. You know you're bound to wind up dead. You don't head back to Tennessee, Jen. A rich man stepped on my poor head. When you get back, you better butter my bread. You know it's like I said, you better head back to Tennessee, Jen. Tennessee, there ain't no place I'd rather be. Baby, won't you carry me back to Tennessee? We'll drink all day and rock all night. I'll come and get you if you don't walk right. You know, little children all in red. You better head back to Tennessee, Jen. I dropped 4 flights and cracked my spine. That's
Sorry.
okay. That's okay. Well, come quick with the iodine. All them freaks, baby, under my bed, and then head back to Tennessee, Jen. Tennessee, there ain't no place I'd rather be. Baby, won't you carry me back to Tennessee? Well, I ran into Charlie Fall, blacked my eyes and kicked my dog. My doggie, she turned to me and she said, better head back to Tennessee, Jed. Well, I woke up feeling mean. I went down to play the slot machine. The wheels turned around and the letters read, better head back to Tennessee, Jed. Tennessee, Tennessee, there ain't no place I'd rather be. Baby, won't you carry me back to Tennessee?
There's an F there.
Yeah. I'm sorry.
No.
The
No, if we're going to do the verse, then you do the C, and then it goes to the F,
Oh.
and this does the verse.
Oh, yeah. Oh, shit. I missed the F. Okay.
That's okay.
Let's go back. Let's do the first one more time.
Let's just start at Tennessee. Let's do the B flat in Tennessee.
Gotcha.
Okay, ready? 2, 3, 4.
Tennessee, Tennessee, there ain't no place I'd rather be. Baby, won't you carry me back to Tennessee? Tennessee, Tennessee, there ain't no place I'd rather be. Baby, won't you carry me back to Tennessee?
Oh.
There you
If
go.
we worked on that, it could be a fun one to
That
do.
could be
live.
fun. That was fun.
Yeah.
It was terrible, but it was fun.
Yeah.
I didn't realize you knew that song. I would have practiced it.
I mean, I know it. I mean, I know it. I don't know how to play it.
Thank you, Pun.
I'll play it.
Hang in there,
I'll
brother.
practice that one.
Yeah, that's fun. Have a.
Oh, I don't practice enough anyway. My hands they just can't handle it.
Well, that's a lot of.
Well, I just need to play more. I've been fiddling around with my keyboard stuff more than anything else. So anyway, all right,
you guys be good. Lenny, come quick with the down. That's right, the realist Steve Lou.
What's that?
The realist Steve Lou says, "Honey, come quick with the down." That's exactly right.
Is Stevie Lou in here?
Yep, Stevie Lou.
What up, Stevie Lou?
Honey, come quick.
What is that?
That's the third verse of the song. Yeah, or the second part of the second verse. It's when you drop
here?
4 flights and drop.
Okay.
Drop 4 flights and crack my spine. Honey, come quick with the down.
Yeah, I didn't even play. I see it now. Yeah, I don't listen.
Well,
to
you're
the
too
lyrics.
busy trying to figure out what I'm doing next. You've got your hands full.
Well, I don't listen to lyrics anyway.
The only time you've ever listened to lyrics, you got hung up on Poncho and Lefty. We did that Willie Nelson song and Merle Haggard song, and you were like, "Oh my God, I can't believe this song!" You actually lost where we were in the song because you were listening to the lyrics.
Oh yeah,
yeah. All the federales say could have found him anyway. And only let him slip away.
Well, you want to play something else before we go, or are you done?
You're
You're
done, I
done.
suppose. We'll play one.
Okay, what do you want to play? Let's play something else.
You have a preference?
No.
Let's do. How about let's do an old Merle Haggard.
All right.
And then old Merle Haggard. Let's do anything from old Merle in a while.
Well, I bet Stevie Lou hadn't heard us do.
Hey, well, I'll do anything. Oh, we could do a little Waylon.
Yeah.
Let's do Waylon. Yeah, let's do that. Let's do it. Waylon. I love this song. I just love it. Super close.
Am I on the wrong key?
Yeah, it's a D. There you go. There you go.
Oh, you should play it on the mandolin.
You think? Yep.
Okay. You can play it on there if you want. That's fine.
Well, I woke up this morning, it was drizzling rain. Around that curve came a passenger train. Heard somebody yodel and a hobo moan. Jimmy, he's dead, he's been a long time gone, been a long time gone. A long time gone. If you want to get to heaven, got the D-I-E. Gotta put on your coat and T-I-E. Wanna get the rabbit at the L-O-G. You gotta make a cold motion like a D-O-G. Like a D-O-G. Yeah. Like a D-O-G. Well, I got a good woman, what's the matter with me? What makes me want to love every woman I see? I was traveling when I met her, I'm traveling again. And every woman she sees looks like a place I came in. Looks like a place I came in. Yeah, a place I came in. I won't care with the break.
Arabic. It's a minor pentatonic.
There you go. Perfect.
Yeah.
I got my name painted on my shirt. Ain't no ordinary dude. I don't have to work. I don't have to work. Nah. I don't have to work.
You know, I could teach you this, the scale that you need to solo on this if you want.
Yeah.
Okay. That's terrible. That's the worst we ever played.
That was not the.
I can teach you the scale that you need for that. You need a. It's this scale. It's just, there you go. Yeah, it's just the regular
D.
Just the regular pentatonic scale. Try that.
Okay. All right, I'll do it.
Okay, ready?
Let's try it.
1, 2, 3, 4. That's better, but just play with it. But play with the, the pentatonic blues scale, and you'll do a lot better with it.
I will. I'm the hip. I play the hippie scale, not the blues. All right, that's good. Let's get out of here, Dr. Steve.
All right. Sorry,
thanks,
Steve.
guys. Y'all have a good one. All right. That was fun.